Hello, everyone. Welcome to another edition of the Go Long podcast. I am here with Dr. Jennifer Rubin Frisch. Jen and I, background, go way back, like decades. Our parents are still friends. We're very lucky that we have that. And she grew up on Long Island, same as me. So it was really great when I reached out to her that she was so generous enough to want to come on and talk about oral health. Few things about Jen, Dr. Rubin. She received her DDS degree from Buffalo School of Dental Medicine in 96. After graduating from dental school, she did a one-year post-residency at Albert Einstein College of Medicine. She is the mother of triplets, married and lives on Long Island while also running her own dental practice. And over the years, she's been practicing family dental medicine for almost 30 years. And she's gained experience in sedation, implants, Botox for TMJ pain, and so many other things that we're going to get into. And her favorite part of dentistry is the relationship that she can have with all of her patients, and they're like family to her. And in her free time, she likes taking hikes. Her favorite movie is Forrest Gump. Favorite artist. Favorite music genre is 90s hip hop. And then, of course, as a dentist, we talked about what her favorite flavor toothpaste is. It is mint flavored toothpaste. So, Jen, welcome to the show. I'm really happy to have you here.
Thanks, Jill. Thanks for having me.
This recording is for informational purposes only. It is not meant to be medical advice. Any healthcare decisions that you make need to be made in consultation with your own healthcare team. So just want to be really clear about that. All right. So one of the things that I'm fascinated about is what has been the biggest trend that you've seen since COVID?
The biggest trend I've seen is people taking that stress out on their teeth. So I find that a lot of people have started clenching that weren't clenching their teeth before, bruxing, grinding their teeth, especially at night when they're asleep. So they're taking the stress. Some people take their stress out on their intestines, their stomach. They get ulcers. They have breakouts in their skin. And then I noticed a lot of patients have started to grind their teeth. And what we're seeing is their enamel starts to wear away and they start to fracture teeth and roots, and they develop all sorts of dental issues from that. So one thing we've been doing for that, one thing we've been making a lot of are these guards for the patient to sleep with, and it doesn't allow their upper and lower teeth to come together. This material blocks and acts as a cushion or a protector for patients, so they can put it in right before they go to bed. And if they're stressed out and their teeth are, if they were going to clench and brux, acts as protection for their teeth. So it's called the night guard, and that's one thing we've been doing. We've been making tons. I have to say, I think since COVID started and everyone was losing jobs, people were getting sick, kids weren't going back to school, everyone's life dramatically changed. And I think that stress created this whole new era of clenching and grinding. And I would say in the last 3 years, I've made more of these appliances than I've made in my entire dental career.
Wow.
So yeah, it's been huge. We're seeing it so much now. So the night guard is usually the first line of protection. It's easy to make. We take impressions of your teeth, and it's custom fit to your mouth, and it takes the stress off of your actual teeth, and this bears the stress instead, this appliance. And then another thing that we started to do is Botox into the clenching muscles, the masseters, the temporalis muscle up here. We inject Botox, and initially Botox was used for migraines, and it would decrease the contraction of the muscles around the head. And then they were finding it was removing lines and wrinkles. And so they said, oh, wow, look at that. Look what it's doing there. It's causing those muscles to not contract. And then they realized not only was it great for cosmetics, but then those muscles that are over contracting when you clench these, especially these masseter muscles, we can put Botox into those, and that also decreases their ability to over contract and gives relief of pain. We have this other muscle up here, the temporalis muscle, which a lot of people who are clenchers have pain up there. So we can deliver Botox into those muscles as well. And it's a great source of pain relief, and it decreases the clenching as well.
A lot of people here, sometimes you struggle to communicate with your healthcare provider because you don't know what you don't know, right? Mm-hmm. And when we had our chat before and you told me about the Botox thing for, just like the stress, I was like, wow, that was totally different and new. How would a patient have that conversation with their healthcare provider, whether it's like the stress and the night guard and then meeting something else? Because is Botox covered under insurance or isn't it?
I believe it's covered under medical for migraines. It's not yet covered for temporomandibular disorders like this. Mm-hmm. So, and not all dentists do it. I started to do it because I had so many patients whose their muscles felt like rocks. Like, when you do a series of bicep curls and your muscle gets really nice and strong, they're using these muscles so overzealously that they're like rocks and they're painful. And sometimes the night guard is just not enough. Mm-hmm. So, and you don't want to be taking Advil and Tylenol every single day for the pain. So the Botox goes in, it's a quick, easy injection. It lasts for 3 to 4 months and it gives nice relief of pain. We've had a lot of good results with it. So I don't believe it's covered by dental insurance yet, but that's something I'd like to see change.
What are some of the questions that a patient might want to ask their dental provider before they have this discussion? Because you talked about the fact that not all dentists do this.
Sure. So like a patient comes in and they keep breaking teeth, or they see their enamel is wearing away and they could see to the under surface of the tooth, like underneath the enamel, that dentin is exposed and their teeth are becoming sensitive and they're getting little breaks on in their enamel on other surfaces of the teeth. And they notice that that's something that they should absolutely bring up to their dentist to discuss for a discussion. And usually the first line of treatment would be to make this appliance, this night guard for them. So they might also complain of pain in their joint, in the temporomandibular joint here, that they feel like they can't open all the way, or they're getting locked when they close their mouth, pain with opening and closing and chewing, pain in all the muscles in the masseters, the pterygoids, which are inside, the temporalis muscle, all the chewing muscles, they might feel tenderness. Usually it's more on one side. You feel it more on one side than you do. You don't usually feel it as bad on both. That's pretty typical.
So question for you, because you do with a lot of, family practice. And so you're dealing with a lot of kids, right? So if my kid has like this stress that they're taking out on their teeth, as a parent, what would one be on the lookout for to understand if there's a problem where they need to come in and see you sooner than their regular checkup?
So usually the kids are pretty aware, like they're doing something, like they feel some sort of discomfort, but they can't exactly explain what it is. And, if we look at all the teeth and the teeth look fine, the x-rays look good, no infections, then we could do an exam on all the muscles and the joint to see if that's the source of their pain rather than a toothache. So for a kid, they will identify, usually identify it as pain. I see college kids coming home for break with all sorts of joint issues, very, very common. And they'll say, I have pain. It hurts when I open my mouth. It hurts when I bite down. very, very common in kids, yeah, like students during finals, during exams, they know something is wrong, something does not feel right. And a lot of times once you rule out the source of rule out teeth as the source of the discomfort, then a lot of times it's that temporomandibular joint. And sometimes they'll even say, oh, I think I have my ear infection, and they'll go to the ENT, and the ENT says nothing, and it winds up being the joint. So they have the joint is actually right in front of the ear. So a lot of time that joint pain mimics ear pain.
Mm-hmm.
So a lot of times if the ENT or the general practitioner is finding nothing wrong with the ears, they say, go see your dentist. It's probably temporomandibular issue, an issue with your joint.
So it may be one of those things that may appear as like something ear related, but actually may very well be jaw related because they're so close together.
Exactly. Headaches are common. Mm-hmm. Neck pain is common. Waking up in the morning, feeling worse when you wake up, headaches and stiffness and jaw pain in the morning because you've been clenching all night. Those are very common signs.
Okay, that's really helpful. So that kind of dovetails into our next topic around like oral health as an indicator of overall health. And we're going to get into like issues specific to women later on in this discussion. But, one of the things I always see about, there's so much advertising is around commercials and gingivitis, right? But tell me more about really what gingivitis actually leads to that people should actually be thinking more about. We all know we need to floss, and I think like a third of the population flosses. I read somewhere.
Yeah.
Let's talk about a little bit about that. All right. Probably need to get a little bit closer there. Okay.
Yeah. So this is an example of healthy gums, healthy bone, the bone, this yellow. What happens with gingivitis is you have this layer of plaque, which is bacteria, and that infects the gum tissue. So you see how it becomes more red up here, inflamed. It'll bleed easier, and it hurts. It's usually uncomfortable. If someone goes to floss with gingivitis, they'll usually bleed a good bit. And then if that goes untreated, what happens is it progresses into periodontitis, periodontal disease. This is an earlier stage of periodontal disease where you could see you're just starting to lose the bone in between the teeth. Again, that's the yellow. I don't know if that yellow, and then the tissue's already inflamed, and now it's starting to affect the bone that holds the teeth in place. And then this one shows more bone loss. You see more of the tooth is exposed than here, where only the crown of the tooth is exposed. Now you're exposing root surface. You're losing bone. You're losing bone in between the roots. The teeth are uncomfortable. The mouth is sore. It hurt. When we clean them, they usually need Novocaine at this point because now we have to get all the way down in there to now clean. Whereas when we were up here, it was just very superficial. Now we're getting underneath the gums into what we call the pockets in between the gum and the tooth to clean out that bacteria. So oftentimes what we'll do is we'll numb the patient so we can really get down there and clean them well, because they need a whole other layer of cleaning underneath the gums.
Right.
So it's a progression from healthy mouth to this. It takes time, but if it goes untreated, if nothing is done, it will progress until bone loss, tooth mobility, all sorts of problems. And the other issue that you have with any sort of inflammatory issue like that, gingivitis, periodontitis, you increase this level of proteins in your blood called C-reactive proteins, CRP for short. And those proteins in an elevated level are not good for any of your organs. It's increased risk of heart disease, stroke, premature birth. There's a whole host of negative, effects on the rest of your body with any sort of inflammatory process. And that is a big one that a lot of people don't usually get treated for.
So what's interesting about this is that, like, you're talking about gingivitis, and another thing we hear in the commercials a lot of times is plaque, right?
Mm-hmm.
And plaque accumulation, right?
Mm-hmm.
So talking about what you just kind of showed in like the diagram, in the illustrations, what happens if that plaque actually accumulates?
It's a great question. So it's called the plaque biofilm, and basically what it is, it's this microscopic layer on the tooth surfaces that cause infection. It's all bacterial, and what happens with time is the bacteria goes untreated. It causes cavities. It causes and then periodontal issues. You see how the gums in this photo here, they're so inflamed. And at the edges there, if you go into there and floss those, that's going to bleed significantly because it's so inflamed, and the body's trying to fight the bacteria and like get rid of the bacteria, but it can't. So it just gets more and more inflamed over time until you get to these situations again where you have the bone loss, and you can see how much of the tooth is exposed here. You not only are the crown portion, but now you're exposing these root surfaces. Our teeth are, that should not be exposed. That should be covered by gum and bone. So it's bad for the whole body. It affects all of your systems, all of your organ systems. It's basically, and I thought this was another good pamphlet about all the parts of the body that periodontal disease and gingivitis affect pretty much everything. It affects everything. Any inflammatory disease like periodontitis affects the entire body.
Well,
the heart and diabetes are huge, big ones. Pregnant women have early labor because of it, increased risk of stroke and arthritis, and the list goes on and on. It's just very impactful on your overall health.
So a couple things there. So bacteria exists in plaque, which was like, wow, didn't realize that. So you don't want more of that. Then the other thing is around, you're talking about inflammatory disease, right? And we're hearing a lot about inflammation in general in terms of society. And there's a lot of autoimmune diseases that also, that people have on top of this extra risk that you're dealing with. Since you have a family practice, I'm assuming you see a lot of people who have autoimmune diseases.
Yes, lupus is a big one. I see a lot of middle-aged women now have lupus. And yeah, that's another one that it's very hard on the mouth. And because your body is essentially attacking its own tissues, you have to kind of you have to fight against it and do what you can control to keep everything nice and healthy. And so great home care is crucial for patients with lupus to not, for that not to work against their autoimmune disorder.
Right. So, you go to the dentist and it's always like, okay, cavities, right? Mm-hmm. Now, what happens when you don't get, you're not on top of your cavities and you're not going for your regular checkups, right? I'm sure that's not a good thing to be doing.
No, it's not a good thing, but the patients, I think, again, since COVID, either like stopped coming, lost their dental insurance,
right.
Wasn't a priority. They were, trying to put food on the table. So I feel like for a lot of people that dental care relapsed a lot, and people are starting to come back now with emergencies and pain and fractures, and people are kind of being driven back now by issues that they're having from not coming so long. And yeah, and we try to educate them on the impact it has on their whole body, so they understand how everything is so connected.
So it went from basically proactive to reactive as a result of COVID.
Exactly. Yeah. Yeah. Yep. And unfortunately for us, we were forced to shut down ourselves. So
right.
we weren't even allowed to see patients for a good chunk of that time.
Yeah. So, but as you said, the good news is that this is preventable. So I will talk a little bit about my story. Like, I wasn't admittedly a good flosser, but I know I was in, I don't want to say great company because we weren't flossing, but 70% roughly of the population does not floss on a regular basis. And then I had a hip replacement, and I was told by my dentist that I need to take an antibiotic, and we'll get into why that's really important and what are those situations that people should understand. But then my dentist, about a year ago, basically scared the crap out of me, which works for me. And it doesn't work for everybody, but it worked for me, basically saying, like, because of the fact that I wasn't flossing, I had this higher risk of infection. And given that I have something not human in my body, that I could potentially be putting that device at risk and have to redo my surgery again. And I was like, heck no, I don't want to do that until I absolutely have to. So I got scared into it. And then 6 months later, I went back in, and she was like, what happened here? Your teeth, like, everything looks great. And I'm like, you scared me. And I floss now, like, twice a day. And
so awesome.
So, but there were a couple things here that were really shocking to me. Like, my surgeon for my hip replacement did not tell me that I needed to be aware of this antibiotic prescription before I go to the dentist. And I'd love to know, like, from your perspective as a dentist, like, what are the situations where people should be aware that they need to potentially have an antibiotic? Because obviously you don't want to overdo antibiotics.
We don't want to overprescribe.
Right.
When the times it's necessary are for patients who have an artificial heart valve. Mm-hmm. Very important for them to pre-medicate. And for people with joint replacements, hip, knee, ankle, shoulder replacements are required to pre-medicate. Some of the orthopedists who do the surgeries ask us to do it forever, to pre-medicate our patients forever. And some say a year or 2 years or 5 years, and then you don't need it anymore. So we go by what the doctor recommends for their patient. But with an artificial heart valve, you are going to have to pre-medicate for the rest of your life. And the reason for that is you have these natural bacteria in your mouth. And when you go and have a dental procedure and there's bleeding, those bacteria get into your bloodstream, right? So now for most patients, that's not an issue. Your immune system will take care of it and no problem. But they found a lot of times with heart valve patients, those bacteria are lodging in the heart valve. They're creating this endocarditis, this very serious heart infection. And with the use of the antibiotics, what we do is give them a dose an hour ahead of time before their dental appointment to eliminate some of that bacteria, and then they are able to come and have their dental procedure safely. With the joint replacements, they also have found that there were instances where patients had a dental procedure and the joint replacement, the joint became infected, the replaced joint became infected, and that it failed and had to be replaced. So those are typically the two situations where we pre-medicate patients with a dose of either amoxicillin, or for patients who are allergic to penicillin drugs, we use another antibiotic called clindamycin.
What about, would you say this is something for, like, all what I would say foreign objects in your body? Because, like, there could be, like, maybe a plate put in, there could be a screw put in, which isn't exactly a joint replacement. There's also pacemakers, right?
Yes. Pacemakers, typically, we do not have to pre-medicate for. Screws, pins, and rods, typically not. They right now the American Heart Association is now recommending it primarily for the heart valve replacements and for joint replacements only. But we do sometimes, we'll call the orthopedist just to be on the safe side to make sure we're doing right by all our patients and just make sure that they don't want their patient to have it if, because they did the surgery and they know exactly what's going on. We like to just confirm that with them.
So if as a patient, if someone is listening and they have some kind of what I would call foreign object in their body, they should be better safe than sorry. And they should first, obviously disclose that to your, dental provider, but then also have that conversation with the doctor who performed the procedure.
Absolutely. And usually the doctors will tell them, you need to pre-medicate before you go to the dentist. You need to take this dose of antibiotics. Unfortunately, when we have new patients come in and they say they've had a joint replacement and we'll say, oh, you need an antibiotic. And they'll say, what? What are you talking about? My doctor, like you, kind of like your situation. Yeah. So then we have to now get in touch with the doctor and see, and then the doctor will usually say, yes, they need it for 2 years or 3 years. And the patient is, totally blown away by that. And it's a hard way for us to start off with a new patient, telling them they need something that they knew, nothing about. So it's great when we do have those doctors telling the patients, like, you are going to need, when you go to your dentist, you must take this an hour before your appointments for however long they want.
Got it.
You take it.
All right. So let's go to brushing and flossing. So there's water picks out there, there's floss picks, and there's traditional floss, right? Mm-hmm. With water picks, are they effective? Are they not effective? Like, if you don't have a lot of time, right? Because everyone's busy. I mean, you're a mom of 3 and you run your own dental practice, right? So, and amongst other things that you do, which I'm sure are considerable, right? Where do you stack rank, say, water pick usage versus floss picks versus using traditional floss? Is there a difference?
The floss picks and the floss are both really, really good at physically removing food particles from in between the teeth. If there are patients who say to me, I absolutely will not floss, I don't care what you say, I hate flossing, I can't stand it, then we'll try to get them to use a water pick. Some mm-hmm. patients, we have them do both because they have such wide spaces and brazier spaces mm-hmm. in between their teeth that sometimes both are indicated to get everything out. But yeah, I mean, I think the water pick is a really, really great device too. I actually use both myself, and I feel so clean and good after. I feel like I've gotten everything out, all the food, and so I know that I'm not going to go to sleep with like bacteria accumulating in between my teeth, and my gums are not going to get infected. So, and it's good for your overall health to do it. But floss for me is probably the number one, and then water picking is a close second. They're both very, very important and good for you.
So another thing that a lot of people don't realize, and my husband had told me this, is that there's such a thing as brushing your teeth too hard.
Yes. Overzealous brushing. We see it a lot. We used to use, I don't know why, in the 70s and 80s, we thought that the hard toothbrush was the best.
I remember those things. Those things were terrible.
It was like brushing your teeth with a Brillo pad. I thought it was like so abrasive to your enamel. So now we recommend either a soft toothbrush, and going gently will get everything off the tooth. You don't have to, overzealously brush, because you do wear away enamel with too much. Another great thing that they have are these electric toothbrushes, these spin brushes. And if you put too much pressure, the machine will beep and say, you too much pressure, you don't need that much pressure. And it beeps when you're pushing too hard, which is a great device for people to learn how much pressure do you really need to put to get your teeth clean. So yes, overzealous brushing is a big problem.
Mark had gotten me into using a Sonic Care because his dentist had previously recommended it, and this was like 20 years ago, and they've come down so much in price since then. And they actually tell you okay, now's the time to flip to the next part of your teeth and the next part of your teeth.
Right. So you're not spending so much time in one area
Yeah.
and overdoing it. It's there's no reason to. The toothbrush, a soft toothbrush with a little time and just maneuvering it properly is all you really need to get those surfaces clean.
Okay.
You don't need to do it to overdo it.
All right. So then last question on this particular topic. Are there ingredients in toothpaste that people should avoid? Because there's obviously like the big marketing. There's like Arm& Hammer, there's Crest, there's Aquafresh, there's Colgate, and then there's like 30 different variants of all of them.
Yeah, so I would say, I mean, some of them promote charcoal, have charcoal and baking soda, and they say they're going to whiten. The main thing in toothpaste you want to have is fluoride. Fluoride is essential to remineralize tooth structure, to protect the enamel, to prevent decay. That would be, and the ones that have the appropriate amount of fluoride in them have the ADA seal on them too.
Okay, that was going to be my next question, because with like supplements, there's no regulation. People could put whatever they want on there. So I was going to ask you, is there some kind of place that people could go look it up, or the symbol that you talked about, the logo you talked about?
Yeah, the American Dental Association logo on a toothpaste is generally one that I would recommend because it has the proper amount of fluoride in it to remineralize and protect the teeth.
Got it. Okay. So I want to segue into sleep apnea, right? Because when we were touching base in prep for this call, you mentioned something about sleep apnea and that you wanted to have a conversation about. And then I did a little bit of Googling on sleep apnea, and there have been some recent studies around the prevalence of sleep apnea increasing, quite a bit between 2007 and 2017.
Yes.
Right, particularly with women. And then there's a lot of sleep apnea, particularly with women who have a history of depression, anxiety, or PTSD. And sometimes you're getting a lot more of that depression and anxiety when you're going through perimenopause. So let's talk a little bit about, how does someone know they're at risk for sleep apnea, and how does dental care play into that? So
patients who are at risk sleep apnea, people over 50, so your middle-aged women and men, and people who are overweight with a BMI over 27, a larger neck circumference, a larger tongue with a smaller mouth, a smaller arch, they're at risk for sleep apnea. Now, why is that an issue? Why is sleep apnea dangerous? It's dangerous because you have these apnea episodes during the night that where you literally stop breathing. And so what happens is your brain is like, wait, we're not getting enough oxygen. So it's telling signals to your heart, and it says, heart, you've got to pump faster because we've got to get these organs perfused with oxygen. So now the heart is under a tremendous stress, right? And that's why it makes people who have sleep apnea at such a high risk of heart disease, heart attacks, strokes. You hear about these people having heart attacks who were never diagnosed with sleep apnea, and a lot of that is because of the stress it places on the heart. So what happens is your body wakes yourself up after a while. When the oxygen gets too low, your brain is like, we got to do something else. This isn't working, and you wake up. Usually people will wake up and gasp for air and then go right back to sleep and get into another sleep cycle, have another apnea. If you're having more than 5 of these episodes in an hour, that's considered mild sleep apnea. When you have 5 to 15, it's considered moderate. And over 15 to 25 to 30, those are severe. That is severe sleep apnea, and those patients are at really high risk for all sorts of medical problems. So there are really great ways to treat it. What the first line of treatment would be something called a CPAP rather. It's a continuous positive airway pressure. And that you'll have seen patients wearing the mask with the oxygen over their face, and they put it on before they go to bed, and it just forces oxygen into the airway while you're asleep, so you don't have any of these episodes. And it's very, very effective, and it just works really great. The problem with the CPAP is a lot of patients can't tolerate either having something on their face. They're claustrophobic, they're allergic to the material, they keep, ripping it off in the middle of the night. So the patients who can't tolerate that, what we are doing as dentists now are making these appliances. They're oral appliances to treat sleep apnea. So it's nothing on your face, and it basically is moving your lower jaw forward. So it's an upper and a lower with a little hinge attachment. And by moving the jaw just very slightly forward, you're opening up the airway and you're keeping the tongue out of the airway. Mm-hmm. So this would be for patients who have mild sleep apnea or can't tolerate the CPAP. And this decreases the apneas that they're having overnight.
So how would someone know, right? Because this is also new for me in terms of connecting, going to my dentist. I mean, knock wood, I don't have sleep apnea, but there are people who are going to listen to this who probably have sleep apnea. How do you make that connection where it's you don't know what you don't know as a patient?
Right. So sleep is a huge part of your immune system. So if you're someone who's getting sick all the time, who feels exhausted all the time, it feels like you're sitting at a stoplight and you just need to, in your car, and you just feel like you need to take a nap. You fall asleep while reading, fall asleep during a meal, and just generally feeling lethargic and exhausted all day long. And people will say, well, I slept, I slept for 8 hours, but they don't realize that how many times they're waking up, and that sleep is so interrupted that they're asleep and awake and asleep and awake. And it's not good sleep. It's not consistent sleep. You're not getting that deep sleep and that REM sleep that you need to have to feel refreshed and restored. You'll forget things. It just wreaks havoc on your whole body when you don't sleep. You just feel awful.
Right. So the takeaway is that if you know that you have sleep apnea and, let's say the CPAP isn't the thing for you, there are other options, and it could be something to discuss with your dentist.
Yeah.
Whatever that is.
Exactly. We can, if you can't tolerate a CPAP, there are other appliances. I want people to know that there are alternatives to the CPAP machine if they can't tolerate it. And these appliances are great. They're easy to make for us. We basically, the same dental impressions you've had taken for other procedures are exactly what we do, just impressions, and goes out to a lab, and they make you this appliance that just goes right into your mouth, top and bottom, and just moves that lower jaw forward slightly to help open up the airway and keep the tongue out of the way of the airway space.
Got it. Okay, great. All right. So now let's talk about, why are women more at risk for periodontal disease? Because you probably know this even as a patient, that women are dismissed when they bring up medical complaints. It's in your head. Oh, you're just being moody, all of that crap. Right?
Yeah.
So as a woman medical practitioner, right, and a woman of a certain age, let's just get real about why women are more at risk for periodontal disease.
Yes. Women are, so every stage of a woman's life, there are these severe hormonal fluctuations when they reach puberty, when they have their menstrual periods, when they go through menopause. The levels of estrogen and progesterone fluctuate so significantly, and those hormonal changes cause changes in your mouth. So as you get to menopause, you are producing a lot less estrogen. Your estrogen levels start to plummet, and that increases the dryness overall in your eyes, in your mouth, everywhere. You are becoming drier. The significance of that in the oral cavity is that when you're not producing that saliva, it's called xerostomia, or dry mouth. And the saliva the role saliva plays in keeping your mouth healthy is huge. Saliva has minerals in it that remineralize the tooth structure. So it helps avoid cavities. It also helps wash the food debris from the surface of your teeth so that the saliva decreases the risk of periodontal issues. So now you're in menopause and your mouth is very, very dry. And what we typically see, women have this burning mouth syndrome because their mouth is so dry. They feel like their mouth is just hard to move their tongue. Everything's like their tongue stuck to the roof of their mouth. They get cavities down by the gum line. They're very susceptible to decay, much more so when they were younger. They are seeing food, we see more food when they come in trapped under the gum line. So that's putting them at risk for all sorts of issues. And another thing that they're at risk for is these infections, these yeast infections in the mouth called candidiasis, which we see a lot with dry mouth. So that's a real serious issue that we see with women, postmenopausal women, and also at that age, they're also starting to take medications for osteoporosis, for hypertension, for hormone replacement therapies, and all those affect the mouth and also affect the amount of saliva you produce, believe it or not, especially the drugs for hypertension. The antihypertensives are notorious for drying out the mouth. And we see patients who are on multiple medications for that and rampant decay. So many dental issues. They're losing their teeth rapidly due to the decay and the periodontal issues. And yeah, it is a real problem.
So let's unpack that. You covered a lot, which is great, right? So you're a mom of 3, right? So, you have kids, and so if you have a daughter, right, they're going through a menstrual cycle. Is there more sensitivity? You talked about going through all the hormonal changes. So talk about maybe what happens when you have your period or not, if there's more sensitivity there. And if you're pregnant, are there other things that may happen to you that you may feel more sensitivity to because you are pregnant and your hormones are in complete overdrive?
Yeah. So I noticed during menstrual cycles that women will come in and say, my tooth, and it's usually one of their front teeth, and there's no scientific evidence of any kind to support this, but I have found in my practice that they'll come in and say, my tooth it hurts. There's something wrong with it. And I'll take an x-ray and I'll do my exam, and I can't find anything wrong with their tooth. And then we'll monitor it. And then by the next week, it feels perfectly fine. I've had this happen to myself too, when I used to, when I be premenopausal, but it's hard. I don't know how to explain it except for the fluctuation of hormones that must increase the sensitivity of the teeth. Right. So during this period, they're so ultra sensitive, and then it resolves. But then they'll come back the next month. I'll say, do you have your period? Oh yeah, I have my period. That's right. I get sensitive every month, and that I see all the time.
It's not in your head.
It's not in your head. I see it a lot. And in the absence of any infection, decay, or disease, I'll say to them, I'm not going to go and treat I don't see anything to treat right now. Let's see how you feel in a few days or a week after your period is finished, and they're fine.
What about if you're pregnant, are you more susceptible to certain things while you're pregnant, or are there certain symptoms that are just common in terms of yeah, you're pregnant, and so this is going to be more uncomfortable type of thing?
Yeah. So the pregnancy hormones you have that progesterone is super elevated, your estrogen, everything is super elevated. So I have found that the tissue kind of overreacts to plaque and bacteria, meaning women sometimes will get these, what we call pregnancy tumors in their mouth, where the gums are so swollen and
Mhm.
it's hard for them to eat. It's painful. And it just, everything just overreacts to plaque. Like for someone who's not pregnant, they'll get a little discomfort, a little inflammation, and then you have someone who is pregnant and it's so over the top what we see sometimes. So for pregnant women, we try to actually get them in more frequently during the pregnancy to clean them really, really well, make sure we get all that tartar, bacteria out of their mouth so that they have fewer issues during the pregnancy. It's already hard enough on your body. So it's just one thing we want to make sure they don't have to worry about. So going in more frequently to your dentist when you're pregnant is a great thing.
That's really good to know, because I bet a lot of pregnant people wouldn't think about that. So that's really great. And then before we go into like our next topic, let's talk about, like you mentioned, osteoporosis, right? And that's actually why I started Go Long around that. And so, you talk a lot of times when you're talking about osteoporosis, you're talking about skeletal health, but people probably don't think of their jaw as part of that skeletal health, even though it obviously is. So if my bone density is going down in like my legs and my arms and my ribs, I have to assume the same thing is happening in my jaw, right?
Correct. And then a lot of patients with osteoporosis are put on medications, the bisphosphonate medications like Boniva and Prolia, and those medications that they're taking also affect the jaw and affect bone healing.
Mm-hmm.
So a lot of times a female patient will come and say, listen, I'm going on medication for osteoporosis. The doctor, the endocrinologist, wants to know, do I have any procedures I need to do in my mouth before I go on it? Anything, specifically anything surgical, because that if they need an extraction or an implant, those drugs are going to interfere with their healing from that procedure. So we try to avoid, so it affects that jawbone, and there's a condition called osteonecrosis of the jaw, which can occur when women are on taking these medications, and they have this difficulty healing, and they can develop that condition.
Wow. Okay. I never heard of osteonecrosis, but that's something.
Yes.
It doesn't sound good.
It's not good. It's not good. No.
All right. So what is the biggest myth that you wish you can make magically go away if you had a magic wand? Like, patients come in, you've been practicing for almost 30 years. There's probably a couple of myths that you're just like, what in the hell did this start from? And like, how do I make this go away?
I think the number one myth would be that your oral health is not related to the rest of your body. Mm-hmm. Sometimes people are going to doctors, and their mouth is so neglected.
Right.
And I don't think people realize the importance and the connection between everything.
Right.
People will say, they'll come in for a visit with the hygienist, and we'll ask them, so are you flossing because your gums are really bleeding, you're really inflamed, you have bad breath? Oh, I don't floss, but I brush like 10 times a day. Mm-hmm. And the reason why it's not no good is because when you're brushing, you're just getting those same surfaces of the teeth. You're getting the tops of the teeth, the outside of the teeth, the inside of the teeth, but you're not getting in between the teeth.
Right.
With the toothbrush bristles, there's no bristle that can get in there and clean in between the teeth well. So if you're brushing 10 times a day, I'll say to a patient, you know what? Brush 9 times a day and floss once before you go to bed. And that will make a huge difference for you. Because you don't need to brush 9 times a day.
I was about to say, do you have any patients who brush 10 times a day?
There are patients who are religiously brush their teeth, which they don't need to do. I think if you brush your teeth well twice a day, that's great. And if you floss just once a day before you go to bed, mm-hmm. and remove all of that food,
right,
and that attraction for the bacteria to grow there, you're doing yourself a huge service because you are not allowing that bacterial growth in between the teeth for a whole 8 hours while you're asleep.
Well, it's also the trade-off, right? If you take, whatever it is, the 5 minutes to floss for the 70% of the population who doesn't floss, you're going to make up for it in more dental appointments, possible procedures, outpatient, costs for some of it, deductibles and everything else. So it's kind of that, like, if you take the, less than 5 minutes to add flossing to your routine, over time, that will save you time and money and pain.
100%. Yep.
Road.
And all it's good for your overall health, for everything.
Okay. So we've covered a lot. Now, are there any topics that we didn't cover that you spend a lot of time educating patients on? Because we've covered quite a bit, but I'm sure there's things that you educate a lot of people on a regular basis that we haven't covered.
So I think preventive care is really, really important. Coming in for your checkups, getting x-rays. Like, patients will say, I don't need x-rays. I don't want x-rays. What's the point? But there's so much we can see on x-rays that we can't see on a clinical exam. We can see your bone. We can see in between the teeth and underneath your fillings and the roots of the teeth. It shows us a lot, and it helps us make proper diagnosis, and it's very important for your overall health to have x-rays taken at least once a year. If you're someone who's cavity prone or has periodontal issues, maybe more frequently, but it is important to get a proper diagnosis with x-rays and a clinical exam. So that's something I just want patients to be aware of. Those x-rays are very important for us, and they are. I know people are afraid of the radiation exposure, but now most dental offices were using these digital radiographs. So it's so much less radiation exposure. And we cover you up with this lead apron to protect you. And you don't have to do it at every visit, but if you're doing them, once a year and letting your dentist see everything that they can't see just by looking in your mouth, it's better for you in the long run as well.
One of the subscribers, their daughter has an eating disorder, right? And they're getting her help and stuff. But there's a lot out there in terms of how eating disorders don't just impact, like, say, your digestive tract and, like, muscle growth and hormones and everything else. How does it impact oral health?
So for patients who are like bulimic, for instance, one, you're sticking your finger into your throat, which can already cause tissues in the infections in that soft tissue. Mm-hmm. Also, the constant vomiting is very acidic, and it wears away the enamel. So a lot of times you'll see on a bulimic adult or teenager, you'll see on the insides of their teeth, the undersurface is here. You'll see that they have worn away all the enamel to the dentin underneath. Mm-hmm. So it's really destructive. The acidity of that vomit is very destructive to your tooth enamel. Another thing with eating disorders is you're not getting adequate nutrients like calcium and vitamin D, so important for growth and development of your bones, your teeth. That's another factor. And also just not eating and drinking enough will cause that dry mouth. Again, not having a proper diet will create that xerostomia, that dry mouth, which is going to make you more susceptible to decay and more susceptible to periodontal gingivitis, periodontal issues, and all of that. So it puts you at risk definitely for some oral infections and disease.
So it's the same thing in the sense that it still leads to the risk of infection with periodontal disease and whatnot, and all the things that you talked about earlier that could cause other problems.
Correct. Yeah.
Okay. Got it.
Definitely.
All right. Well, I want to thank you for joining me on the show today. This has been very informative. Again, I'll remind everybody, this is not meant to be medical advice for you, you should go talk to your medical professional if you have questions about any of these things. I know Dr. Jen is on social media, so we'll throw some of her social media in the show notes and whatnot. But she practices on Long Island. So if we have any subscribers who are in Long Island, I don't know if you're taking more patients, but you can reach out to her there and see if her and her team have availability. But this has been really instructive and informative, and I can't wait to kind of have some fun with this on video. And thanks so much.
Thanks, Jill. Thanks for having me. I appreciate it. I love it. I love what you're doing.